Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I'm joined by Dr. Anthony Chang. Thank you for being with me today.
Thanks for having me, Rosa. And of course, your last name is a good fit for my profession, being a cardiologist. So this is a great alignment to start.
My goodness, I didn't know it was going to make hearts when I did that. Did you see that?
I saw
Wow.
that.
I hope that's getting
There's
recorded.
AI. It's AI in the background doing
So if any other animations happen, I did not plan that. I'll have to find out what else this is going to do. But we met because I've been exploring more about AI and how it can help us in healthcare to make the future better. As a stroke nurse, I've encountered a lot of suffering, and I am very open to any solutions that can make things better. And you are the founder of the American Board of AI in Medicine and kind of created a certification pathway to help people learn about what even AI is. And so I met you through that, but you have a very elaborate history of things you've started in pediatrics and authored textbooks on AI before it was cool. And
Yeah, that's
um,
right.
and then we're going to be at a conference in November called AI Med in San Diego. And did you start that conference a decade ago? Is that right?
Yes. Yes. Again, before the buzzword AI was popular, especially in healthcare, but
Hmm.
I did feel like it was just a matter of time before we fully realized that it has great potential to be a resource that we so badly need in healthcare.
Yeah. And what first sparked your passion for blending medicine and AI? I heard you mention something about like being used to read like atrial fibrillation and different heart rhythms. Was it something like that where it overlapped with your cardiology practice?
Actually, I have to say, I was such a nerd in high school. I was the only student that was in the computer, chess, and math club all at the same time. And to make things worse, I was the president of all three. So,
Of course you
so,
were.
I just had a really strong affinity to math. And I was really blessed throughout my career, Rosa, that I had mentors who are not only brilliant surgeons or clinicians or researchers, but they also had just as strong an affinity and passion for math. So I really, was riding on the shoulders of giants in my clinical field who are also mathematicians. And I want to say, in particular, Dr. Bill Norwood, who has a surgery named after him. He was such a fabulous surgeon, and he was one of my mentors. And I was very blessed because he allowed me to share with him his passion for math. He's an MD, but he was also a PhD in math and physics.
Wow.
So we found every excuse for me to scrub in on surgery with him and the reason is because the time that we have to put a child on bypass and the time that we come off bypass are just so idle time for about 15 to 30 minutes. And we really enjoy probing each other about, doing projects together and things like that. So I was doing um, AI research, quote unquote, back in the 80s before we had compute, before we had data of certain size. And I was just basically hand calculating for projects that I was doing. And he was absolutely right back then that, for instance, that our biological systems through math can express itself when it's in trouble. So my first research project in AI was trying to predict, as we do now, trying to predict when a patient's in trouble before the before there are obvious signs. So, and he was right 40 years ago that there's some really elaborate patterns that we should be able to recognize if we're smart enough to be able to see them.
Yeah. And we can establish a good baseline of when they're not in trouble to compare it to.
Yeah,
And yeah.
yeah. Of
And
course, now
then
we have compute power and lots of data makes it a little bit easier. But back then, when he had the right idea, but we just didn't have the compute power. But we still were able to do some really interesting research projects looking at chaos theory, basically.
It kind of feels like we're living in a chaos theory right now with the web
Yeah.
of AI options that are happening. Like, you were kind enough to welcome me into your group chat of doctors who are obsessed with AI. If that's
Doctors and
not
nurses.
and nurse
Doctors and
well, yeah,
nurses now.
that's right,
Yeah.
that's right. You gotta tell me who the nurses are in the hundreds of
Yeah.
people in this group.
Yeah.
But, for clinicians who may feel intimidated by AI, who maybe don't do math for fun, how would you describe the current role of AI in medicine in simple terms?
Yeah. I think AI is basically computers and software doing tasks that require intelligence by humans. And that's actually the original definition by Marvin Minsky, one of the progenitors of artificial intelligence. And it's just simply allowing computers and mathematics to do tasks for us that we will have to do by hand or we're not able to do. So I think this is literally the most exciting and the most apt time to get into AI in healthcare because one, computers are so capable now, as we've seen with ChatGPT, that you really don't need to be a programmer anymore to benefit. I remember still taking stacks of computer cards to the University of Maryland Computer Lab to do programming, and now you don't have to be a programmer, so it's the best time. And there are also automated ways of doing programming, even if you need programming. So the barrier to entry has been lowered tremendously in the last 5 years with ChatGPT and ambient intelligence. I was just talking about this with someone earlier in the last hour. So it's really a great time to get into AI in healthcare because there's so many possibilities, and healthcare needs a resource like this so badly that I think the next 10 to 20 years is going to be this Cambrian explosion of, tools that are available for clinicians. And particularly, I'm so glad that you're a nurse interested in this because I see the benefit of AI for nurses even more than for physicians
Why do you say even more than for physicians?
because of all the tasks that you have to do that really create I think an unfair burden to the frontline staff with nurses and you most nurses go into nursing because they really enjoy taking care of patients and people at a time of need. And about 5 years ago I had a medical situation and it again proved to me that the nurses are always there at the bedside. The doctors work hard but they don't necessarily spend too much time at the bedside, and
Yeah.
it was the nurses that nursed me back to health very quickly, and I was able to go on and do the things I was doing. So, just another reminder for me how important our nurses are in the healthcare ecosystem.
Yeah, definitely. And what would you say are some of the biggest misconceptions maybe holding other physicians and nurses back from that you encounter when you're talking to other health professionals?
Um, I would say it used to be that AI is going to replace doctors. I think that discussion has quieted down substantially because people are realizing that it's not really going to replace doctors. It's going to make their jobs more fun and more meaningful and less burdensome, and perhaps even um, reduce the amount of burnout that we see in the profession, not just doctors, obviously, but nurses also. And I think it's going to, yeah, reduce the magnitude of the burden and also make our jobs more fun and more creative and basically, take away the things that we really don't like to do that are necessary to do, but we much rather do something else. I mean, if you look at my day to day, I just had clinic this morning. So now I have to make a bunch of phone calls and connections, order a bunch of tests and justify them. All of these things I really don't like doing. I do it for the sake of my patients, and the nurses do similar things for their patients as well. But we really don't need to be doing these things. And we'd rather spend time, I think, talking to our patients and making sure they're okay and reassuring them and rather spend our time on the phone or on the computer trying to get these things done.
Definitely. That eye contact is a lot better than staring at a screen. So,
Yes.
especially that like ambient scribe transcription
Yeah.
function can help a lot.
Yeah.
Um, I'm really interested in things that can track movements and maybe things that could track how many times nurses get interrupted when they're trying to do 5 of those tasks at once.
Yeah, 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 yeah. That'd
But,
be yeah, it'd be a good study. Well,
that would be
um, I say AI is the new stethoscope,
Oh, yeah.
because yeah, I always think that the stethoscope is the best technology that was ever invented because it's a universal symbol that I'm here to help you,
Mm.
so it's widely recognized. But I think AI, if it's done correctly, could be our stethoscope for the 21st century.
And there are stethoscopes using AI to interpret what they're
That's
hearing,
right.
isn't it?
That's right. That's right.
So it's a good
Yeah. So
example all over.
yeah, yeah.
Um, so going back to ABAIM, or how we met, you founded that and with some other physicians, I think, that were
Right.
equally as motivated in making other clinicians feel competent or and bringing them up to speed on laying some foundations because a lot of people don't even know where to start. They know they need guardrails. They're afraid to bring in change, they're afraid of breaking things worse than they already are, but they don't know where to start, and it seems so confusing. So, to me, this looked like light at the end of the tunnel as far as it's
Yeah.
a starting place. And,
Right.
can you tell us some more about that and why you decided to make creating that a priority?
Yeah, we wanted to make artificial intelligence very relatable for clinicians. And sometimes artificial intelligence seems very enigmatic and difficult to understand, and people are very intimidated by an entirely different, domain. And clinicians are very bright in their own field, but are still rightfully intimidated by something that's totally foreign. So we wanted to basically have clinicians and data scientists teach a course that makes it very reliable and I think relatable. So I think clinicians still can relate to clinicians more. And so we teach the data science and AI concepts and applications in a clinician friendly sort of environment so that clinicians can feel very comfortable learning that AI is a resource for them and not something in addition to everything else they have to learn and keep up with, that
Yeah.
this is a tool, is a resource and a tool that can be used to reduce their burden and make their jobs even more interesting.
Yeah, and for the people who are concerned that they might lose their job to AI, do you see the creation of new jobs related to AI in healthcare, and what would that look like?
Yeah, I see lots of interesting jobs that will be created. You remember, I'm old enough, Rosa, to remember when ATMs came out. And we were all very curious about this machine that can hand out money, and
Ooh,
we no longer have to go to banks and line up to see the teller for the cash.
mm,
And people were saying that everyone who worked in a bank will be losing their jobs. And as a matter of fact, the number of branch offices and banking actually increased
mm,
substantially after the ATMs came out because everyone kind of upskilled and started doing different things. So instead of tellers handing out or cashing checks for money, they started to become more involved in financial management and mortgage applications and things that were probably for their careers more interesting. And I see the same thing happening in medicine with AI that a lot of things that we're doing are very mundane, very task oriented. Probably depending on what you do in your career, probably anywhere from 20 to 30% to maybe even more than 50% of your job could be, replaced by a automated safe tool so that you no longer have to use your human energy and resources to do those things. So if we can upskill and do more interesting things and also spend more time with patients, I think it's going to be a huge plus for medicine. I mean, if you go to the average ER now or spend a typical day in the hospital, you're going to be seeing a lot of humans huddled around computers but not around patients, which is interesting,
mm-mm.
right? So, because it used to be that we spend most of our time at the bedside talking to patients and rounding, and now doctors and nurses are all very much occupied with the computers and the screens rather than spending time with patients. So I'm hoping that AI, as it matures, will be a really wonderful resource to take away the screen time for clinicians and for nurses and give back the time that that we need for our patients. Because I think we've been basically held hostage with computers now. If I could design a hospital of the future, Rosa, if you can imagine this, that there'll be no screens and people will be spending time with people. I think that's ultimately the future of healthcare, is that the AI will be sort of make the screens disappear, and that we actually will be dealing, eye to eye with with all of our patients, rather than spending a lot of our time in front of a screen.
It reminds me of Star Trek and when they're talking to the
Yeah,
computer and they're interacting with it, but they're not having to stare at a screen. They're just like conversational
right,
and
right,
it does things. And maybe it even has like an avatar so they feel like they're interacting with a person. But
exactly.
but yeah, that way it maintains that human connection and instead of distracting from human connection, which is
Yeah,
really important to me.
yes.
Um, so do you think that it's really important for healthcare people to be involved now as these systems are being built? Or why couldn't they just wait until it becomes more mainstream?
Well, as someone said famously, the future just doesn't arrive. You have to work for it. So I think, if you can imagine a hospital in the future, I just got off the phone this morning with a medical center in China that's interested in having me go out there and try to come up with some ideas about the future of hospitals. And I can see that a lot of things are going to be more automated with safety, of course, and that AI will be embedded in different parts of the hospital, so that we basically, increase the capability of our clinicians, nurses, and physicians, and pharmacists and respiratory therapists, because a lot of the mundane tasks will be taken up by the AI. So it's not just automation, it's also putting us at a different level of practice. And I think that's the exciting part. I think a lot of people are looking at AI as automation. As a matter of fact, people want to call it augmented intelligence or automated intelligence. I think it's capable of doing much more than that. 5 to 10 years from now, we'll be looking back and say, wasn't it interesting that 10 years ago, we were thinking that AI was ChatGPT and ambient
Hmm.
intelligence, because we'll be doing so much more. I'm about to give a couple of keynote lectures this week, and I'm amazed how one of them is in oncology, a field related to what you're doing. Um, and it's amazing how in oncology, with the future of AI bringing multimodal, monitoring and surveillance, as well as the concept of digital twins, in which we replicate copies, virtually, of patients, so that in the future we will not be uh, tethered by randomized controlled trials as the only way we gain new knowledge, but it will be what I call N of 1x research, so that digital twins so each person will have their own clinical trial, because you have many copies of yourself to find what's the best chemotherapy, what's the best stroke management scheme, because strokes are not all the same, as you well know.
That's so true.
So
Well, and some
yeah,
people are
every,
not responders to things like Plavix, right? And it's so awful to have to try somebody on a drug for a week or two to see if,
yeah,
or longer to see how their body
yeah,
reacts to it. If we
yeah,
could know ahead of time, that would be really
yeah.
helpful.
Yeah, I think we'll be inching towards real precision medicine, where every patient has his or her own trajectory of responsiveness to medications and to therapy, and also management. And so there will be multimodal AI combined with digital twins to give us precision medicine. And then to manage all of these patients, a lot of our time as clinicians are taken up by trying to manage patients in chronic situations. And a lot of those tasks take up a lot of time and probably eventually make us all very frustrated, especially when you're dealing with payers and things like that. So in the future, I think everything will be much more streamlined. There's a lot of curiosity, but also some fear of the next wave of AI tools called agentic AI. But I think agents will be, if done correctly, can really reduce a lot of the burden in healthcare, so that we are going to be able to spend more time with our patients. Patients need us to spend time with them, and
Yes.
they always tell me that they wish they had, just more access to clinicians in general. So I think in the future that will be very, very much that burden will be very, very much alleviated by AI.
Yeah. There could be a lot more said about the benefit of the therapeutic relationship, right?
Yeah. So ironically, AI is going to what I call rehumanize medicine, which I'm very excited about, because there's always this ongoing debate about how AI is going to make us less human, but I argue the opposite. I think AI is going to make us more human because we will reduce the time in front of screens and go back to patient care, which is why most of us go into healthcare.
Yeah. And for a podcaster, they have AIs that can create podcasts, which can be nice to create an audio option for
Yeah,
something if I need
yeah,
to be looking at something else. But people don't get the same emotional resonance when they're listening
yeah.
to the AI voices. And a lot of the times, even if they can't pick out elements, they can emotionally feel that this is not a real person. I'm not emotionally responding to this. And maybe that will get better, but like in the
Hmm.
holograms in Star Trek, right? Where they could get really emotionally involved in their scenarios. But this brings me to the $1 billion question. So, in every episode, I ask my guest, if you were given a grant for $1 billion to meet the needs that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
If I had $1 billion, I would build, and actually have envisioned this already, Rosa.
I believe you.
I will. I don't even need $1 billion for this. For
Okay.
those of you who are listening out there, I would build the state-of-the-art AI center or institute that will be entirely focused on the pillars of the quintuple aim, so that we aim for better delivery of healthcare with pay attention to the outcome, pay attention to the well-being of people, including healthcare workers, and really aim for that kind of health system. Essentially, build virtual copies of projects, virtual copies of our patients, virtual copies of our caretakers and health systems, so that we really maximize the benefit of artificial intelligence to be able to predict, right? It's
Mhm.
ultimately a prediction machine to predict the best course for all of our patients, all of our caretakers, and the health system in general, and really, really try to reduce the economic and the human burden of delivering healthcare. So I would build an institute that's entirely focused on using AI as a very much needed and timely resource to be able to achieve that. And I think it's very, very possible, but it does take a lot of talented humans to
Mhm.
be able to achieve that aim.
Yeah. All the more reason for people who understand healthcare to get involved in designing these
Right.
systems, right?
Yeah.
Because the
It's going to
data
take
scientists are not
clinicians.
yeah, the data scientists are not gonna know how to enter into the mess that we are already in.
Right. It's kind of like, as you know, I draw the analogy between astronauts and healthcare, because my daughter is interested in being an astronaut. So most of the astronauts now, there are 682 of them. Most of them are engineers, and also obviously they can pilot. But we need the clinicians to have the same mindset that we cannot just be clinicians. We need some of us, a cohort of us, will need to be what I call bilingual, speak clinical medicine as well as speak data science and AI, so that we can then form a cohort to guide the rest of us into the next century. And I think you remember during the course I mentioned that there's 682 astronauts. I don't think there's 682 clinicians that can speak AI right now. That's probably 100 to 200 at most around the world. And there are 50 to 100 million clinicians. So we're 0.00002% of the entire cohort of clinicians. So we need many more doctors, many more nurses, and especially many more nurses to really be at least literate, maybe not fluent, but at least be literate in AI to help guide how to best use AI. You're absolutely right. AI, as good as data scientists are, and it's good as AI experts are, because they're not always very literate in clinical medicine and healthcare, we end up with projects that really don't get adopted into practice. So we really need the clinicians. I know it's doing it the hard way, but it's doing the more sustainable way to have clinicians like yourself. And I was so pleased when I saw you in the course, because we are starting to see more and more nurses, and I think that's a wonderful, wonderful part of the healthcare ecosystem that can really make a make impact and make a big change.
I think so too. So, for others who are ready to take the first step, and where can they learn more about the certification and how to get started in learning about AI?
Yeah, we make it very user friendly. You don't have to have any A background. You don't have to have any programming background. You can just come in, and what we usually recommend is take the 1 day primer. The 1 day primer can just get you started, get you comfortable. It's kind of like the appetizer in a restaurant, and then we have a basic course that's 2 days, and then we have an advanced course that's 2 days, and each of those courses are coupled to an assessment that you can take. We don't want to call it an examination because no one likes to take tests. So it's an assessment to see how much you know, and you can take the assessment, and if you pass, you get a certification at that level granted by the American Board of AI Medicine. And we've had um, a lot of people that have come through and taken the courses and gotten certified and have taken that certification to their leadership and gotten really good, opportunities and even leadership positions to drive the AI agenda in their health system or company. So really, and also create a movement. There are a few
Yeah.
clinicians and nurses that are actually creating like yourself, creating a movement in your tribe of clinicians to make a difference. And it's so gratifying for us to see, significant transformation of a subspecialty given a few clinicians that have a passion to make change with AI as the resource.
Yeah, I absolutely love using technology to amplify our efforts. And
Yeah,
that's one thing I really loved listening to you guys talk about on the ABIIM office hours is the way that we can use technology to scale our impact and multiply it so much further than we could. And that's why I love podcasting, because you can essentially share a conversation, a really in depth conversation, qualitatively in context with such a larger amount of people and connect people who otherwise would be really disconnected. And so to me, I feel like it's very synergistic, right? It's
yeah, no,
all
I
part of the
agree.
same concept.
Yeah, yeah, totally agree. And one of the reasons, um, because someone said, why don't you just make some videos and then have this be available? But I think the human learning experience has to come from a live interaction. And it's really hard. I mean, what happens is when you listen to a video is by definition, a passive participant. And it's really a beautiful symphony to hear from our participants in the course as we're talking to come up with questions. And that's why every month the course is different because we have different faculty that rotate in and out. we have different attendees that have different subspecialties. And as you saw, the diversity is tremendous. We have medical students to deans of medical schools to hospital administrators to nurses, sometimes even patients come on these courses. So, next month for the basic course, I just heard from from Mijanu, our uh, executive director, that we might even break 100
Nice.
because there's 96 some people already registered. So the interest level is definitely up. We try to make these courses very user friendly, so no one has to be intimidated by. There's no programming. There's hardly even mention of a programming language. We wanted to make this as friendly and as relatable as possible for clinicians. And being a clinician myself, I can see how they can relate to AI and not be fearful of AI and just be curious and be passionate about learning it. And also, I think they realize that by having a degree of literacy in AI, then they can go on and convince their cohort of clinicians to make change with it. And I think, if you take the basic course and take the advanced course and you get certified, I think we're very comfortable saying that you're in the top 0.1 to 1% of clinicians and the level of expertise on AI, because people have just been very impressed with how fast they have learned such a difficult area, and we're always impressed. And we're always available to help anyone. So I think most of the faculty give out their phone numbers. Even I get plenty of texts from people,
Yeah, you do.
uh, and it's just so gratifying to see people take what they have learned in the course and keep going to the next level. As a matter of fact, we have to now create different programs, a master's level program and a doctorate level program, because people just keep going. They just keep wanting to learn more. So it's a really, really exciting time to be a clinician, Rosa, at a time that unfortunately a lot of us are sort of demoralized, and we're beaten up by the pandemic and the stress of being in healthcare. And some of us are not even recommending healthcare for our family members or for our friends. And it's a sad time for me.
Yeah,
So I'm trying to bring hope through AI into healthcare so that people get excited. So what's encouraging is I just spent a whole summer with about 85 summer interns that are interested in healthcare and also AI. And, you know, um, there are more students applying to different schools than ever before in healthcare. So that's our hope, is that the younger generation, with our help and particularly leveraging AI to as a resource, will hopefully give them a really bright future in healthcare.
that's amazing. I'm so excited to get to be part of it, and,
Yeah.
I really appreciate you not getting tired of it. I mean, you've been
No, no.
working on this a long time, and you're still so
40
passionate
years.
about it, right?
Almost 40 years. Someone said you waited a long time for this to happen. I said, 40 years seems like a long time, but it went by pretty fast. I remember days and nights of doing research at the bedside, and my mentor, Dr. Norwood, would come by and say, "Don't give up. Someday this is going to be absolutely huge." And he passed unfortunately a couple of years ago, but he did get to see AI really flourish and become a real resource and a real area of focus in healthcare. So he did get to see that,
Good.
and so in a way, that's a tribute to him that he's leaving us such a beautiful legacy.
That's so good. Well, I'm glad to hear that. So, for anyone who is listening to this, if you want to come see us in person in San Diego in November, go to aimed25.com and get signed up to come in person. We'll have that primer on the first day. I'll be working on a panel with nurses who want to talk about AI. And what is it? There's 1,000 attendees that
We're
are going to
expecting
be there.
we already have close to 400 register,
Yeah,
and we
and
still
right
have
now we're in
3 months to
August.
go.
Yeah.
We still have 3 months to go, so I'm very excited. That's going to be a really good sized crowd. And I think, as I always say, Rosa, everything in AI and medicine has to be built on human to human relationships. And so we have to build this thing. The humans have to build the AI in healthcare, not AI itself. The AI is there as a resource, but we actually have to build this. And I always draw analogies also to Formula One racing because I'm such a big fan. But imagine that there are lots of Formula One cars lying around, but there are not enough drivers. So the clinicians need to learn how to drive the Formula One cars, just like the clinicians need to drive how to use AI as a resource. It's almost like the resource is too good to be true right now in some ways, that we just need to have enough clinicians to be able to take on the technology and and make good use of it.
And harness it, right?
That's right. That's right. And
Yeah,
especially our nurses. I'm
that's
so
right.
glad to see people like you
Yeah.
leading the charge for nurses to come together and really think about creative ways of using this resource because even the physicians can't sometimes grasp, the things that you have to do. Something as simple as scheduling. I had to do
That's hard.
scheduling for quite some time and for nurses is even harder because you have more numbers and more sort of situations you have to handle. But AI can even help with scheduling,
For
So
sure.
yeah,
Yes. See, things
so I
like
think
that do not need us to waste our brain power on them.
that's right. That's right.
We have
That's right.
clinical things we need to be worried about.
Right.
Please,
Right.
let's subtract some of
Yeah.
that admin
Yeah.
stuff out.
A few hospitals, Rosa, have used AI to basically totally get rid of nurses having to schedule nurses. So think about that one task
Oh,
taken away
definitely.
from you. Yeah.
Well, that was actually one of my projects at a nurse hackathon that I attended. Rebecca Love led a hackathon at Health last year in 2024, and our group dedicated our attention to how do we solve for scheduling, and it was not a winning thing, and they didn't implement it, but we definitely caught the vision for this could
Yeah.
make such a huge difference.
Right. Yeah.
So,
Scheduling and how to handle crisis situations. I mean, all of these things
uh,
or how to deliver the best, post-op discharge strategy. All of these things are really humans alone can't handle these tasks any longer as our patients get more numerous and our patients get more complicated. It's not unusual for the typical adult patient, as you know, above 65 to be on 10 different medications. So just something simple as that, trying to manage all of that. So we really need, I think medicine and healthcare are no longer human endeavors. They really need to be coupled to healthcare, artificial intelligence. And one of the things I made up is, you know, AI in healthcare has transitioned from a GPS, which is nice to have, to a safety belt. I think a lot of the issues with quality and safety, Rosa, in the future will
mhm.
be really driven by AI tools.
Yeah. Especially if we wanna make real-time changes and not wait
Yeah,
for a month or 2 for
right.
reports to come back for
Yeah,
us to make a
yeah,
change that could have
yeah.
prevented a lot, right?
Yeah.
Yeah.
And even though humans try very hard, we have to just be humble enough to say, you know what, humans are not doing a fantastic job. So
You
so we really
know
have to be proactive. Yeah.
yeah, I think we talked about that. I mean, before talking about having AI and EHRs in all the hospitals, what was it? Medical errors were resulting in, like, the l 3rd leading cause of death or
Yeah.
something,
Yeah.
and that's pretty human. So, we're holding AI to a higher standard.
Yeah.
So,
But we have to be fair about it too, right, Rosa?
yeah,
Because sometimes we'll say, oh, see, the AI was only 95% accurate. Well, humans have not done as well.
yeah.
So we have to be a little bit fair about, using AI as a partner in that we have to be a little bit forgiving when it's not perfect. Just like we are very forgiving when humans are not perfect, right?
And then learn from that and make it
Yeah,
better.
yeah.
Yeah. Well, thank you so much for meeting with me today to talk about how we can make the future of healthcare better. And if anyone wants to reach out to you, is LinkedIn the best way?
Actually, my phone. I'm willing to
Well, let's not give out your
give out
cell
my
phone
stuff.
number just
Okay,
in
all right,
case.
okay. Yeah, yeah, I'll leave it up to you, Rosa. But I'm perfectly happy for them to text me on my phone because I get about 500 to 1,000 emails, so it's really hard to reach that. But I'm here. I'm a big fan of any clinician that wants to explore the space for his or her, you know, passion to help in healthcare and young or old, you know. So just this morning, a senior clinician texted me and say, you know, I'm about to retire. I'm 66 years old, but I'm really curious about artificial intelligence. Is it too late for me to learn about artificial intelligence? And I said, it's not too late. I had an 88-year-old nephrologist that came to a meeting to listen to a talk I was giving on AI because he still wants to learn and he wants to see how
Great.
he can help healthcare. I was so moved by that and
That is
inspired by that.
amazing.
So yeah, I was so you're never too young or too old to
Yeah,
be, and that's the beauty of AI is I call it the equalizer because you could be a medical student or a Harvard professor. It doesn't matter because everyone can learn something from everyone else.
that is a great way to approach life, really, ready to
Yeah,
learn.
right.
All right. Well, for everyone who's listening, if you learned something and you liked this episode, please like it wherever you're listening. If it's on Spotify or Audible or Apple Podcasts, or if you're watching on YouTube, leave me a comment with what you learned or any questions that you have. And make sure you subscribe so you will be notified of the next episode. And I will be dropping Dr. Chang's information in the show notes as well. So make sure you follow, and I'll see you in the next episode.
Rosa, I also want to say thank you for what you do because this is an extra effort and really, I think we're really inspired by your energy and your dedication to just do something to improve healthcare. So thank you for what you do.
Thank you. I'm not gonna cut that out. I'm gonna have to keep that one.
Please.
Thank you. All right.
Okay.
We'll see you next time.